Hi, Dr. Ken is ready to see you now.
Great, thank you.
Hi, come on in.
Hi.
How are you today?
Good, how about you?
I'm doing well, thanks. Have a seat. All right, so it's really important before we get started that we make sure we have everything in order. So one thing that I'd like to suggest is that your child see a dentist before we get going, because radiation can affect the bone healing process. So it'd be important to make sure that we have her dental health ready to go before we start the radiation treatment.
All right, great.
Do you have a dentist that your child knows or has been seen by?
No, we haven't been regularly seeing one.
Okay. Well, we do have an awesome team here associated with the hospital. Let me get you connected with them.
Okay, great, thanks.
Good morning, everyone. I'm Mr. Che, the hospital's patient care facilitator. The purpose of today's meeting is to discuss and evaluate a child's dental needs before she begins radiation treatment. This is Dr. Cannon. He's our oncologist. This is Dr. Garcia. He's our pediatric dentist. He does amazing work with pediatric cancer patients. And this is Lauren, our hygienist. She works with cancer patients at hospitals to provide cleanings.
Great. Well, to get going, like we know, Kristen's cancer is progressing, so I'd like to start radiation as soon as we possibly can.
Yeah, we're going to want to do a thorough evaluation to see if there's any teeth that might need to be extracted. Because if that's the case, then radiation will have to be delayed for 2 weeks. It can be really tough on the bone. In addition to that, if there's any teeth that need to be filled, we'll get that taken care of too, because once she starts her therapy, it really won't be as big of a concern for them.
Okay. Thank you so much for your concern. I really appreciate it. But with all the medical bills, I'm really not sure how we're going to pay for that. We don't have any dental insurance.
It's a really good point, but I don't want you to worry about that. We actually have a program here that organizes dental treatment for families that are in your situation.
Great, thanks. I didn't know that existed.
So I know that cancer can be tough on the child and on your whole family, you know, so if there's anything that we can do to make her more comfortable when we come in to see her, like if she has any interest, if she likes a TV show or anything like that, or...
She really loves Pokemon.
We can work with that.
That's it.
I wanna be the very best, like no one ever was. To catch them is my real test, to train them is my cause. I will travel across the land, searching far and wide. Each Pokemon to understand the power that's inside. Pokemon.
Hey, Kristen. How are you today? Good.
That's good.
All right. We're going to get started by taking a few pictures of your teeth, okay?
Okay.
Yep, I'm just going to take a quick peek and see what you got going on. Wow, you got some big ones coming in. Nice. Has the tooth fairy visited you?
Yeah!
Nice. Cool. Okay, so Kristen, you've just got a couple cavities on your molars. Those are the ones that are way in the back. And so I think we can just take care of those today later on.
Okay. Yeah, the sooner the better.
Okay, I'll call down to the dental clinic and schedule an appointment.
Kristen, we just finished up your third round of radiation, and you're responding really well.
So I'm just going to take one more quick peek in your mouth. Yeah, everything looks really shiny and nice and looks great.
She has been complaining about dry mouth, so is there anything we can do about that?
Yeah, so actually we can. During radiation, it's a very common side effect to have dry mouth because radiation is so close to the salivary glands. So we can definitely give her medication for that. But if she has any other concerns, you can bring her into our office and we can take care of that as well.
Thank you guys so much for all your help. We really appreciate it.
Oh yeah, it's our pleasure.
We're happy to help.
Keep being the very best.
like no one ever was. Pokemon!
It's you and me. I know it's my destiny. Oh, you're my best friend in a world we must.
This is Dr. Cannon. He's an old friend of mine. He's a great dentist, amazing dentist. He's been practicing. You're the dentist.
Yeah.
You do.
Do that. I'm gonna check for things that the teeth are dying, and see if we can pull those before we start raising. That the teeth are dying, and that the teeth are dying, and teeth are dying.
Double
This is the other one.
Nice.